Hello everyone. In this video we would be going over definition and stages of normal labor, and along with normal labor we would be also going through what abnormal labor is, and then we would be concluding with the physiology of labor, a brief overview of what that is or what that includes. So coming to the definition of normal labor. So labor is defined as the series of events that occur in the genital organs in an effort to expel the viable products of the conception, which are fetus, placenta and membranes, out of the womb through the vagina into the external world. So whatever is produced during the conception, these three things are expelled out of the womb, and this process happens with a series of events, and that is labor. So what is it characterized by? Regular uterine contractions which lead to effacement and dilatation of the cervix and fetal descent. So these are the most important ones: uterine contractions that lead to effacement and dilatation of cervix, which also lead to fetal descent. And coming to some terms, so one is term. So term means after 37 weeks of gestation, but if it occurs before 37 weeks, it is known as preterm labor. So term labor, preterm labor. And there is another term which is delivery. It is the act of expelling or extracting the fetus from the womb. It may occur spontaneously, be aided with assisted vaginal delivery, or be achieved through abdominal delivery, which is C-section. So cesarean section. So first one is spontaneous. So spontaneous just happens, physiology. Be aided. So in case it requires aided some kind of intervention, there is assisted vaginal delivery. Or when there is complete, you want it to happen through the section, through the abdomen, surgical incision, you do the C-section, cesarean section. Therefore a delivery may occur without labor, such as in elective cesarean section. So this one makes sense. Coming to normal labor, what does the definition entail? So it means fulfilling all of these criteria. So it's also known as eutosia. So spontaneous labor at term, that is the first point. Second one is vertex presentation. Third one is without undue prolongation. Fourth one, natural termination with minimal aids. This point is being looked at. No complications affecting mother or baby. So first one, spontaneous onset. Labor should begin naturally between 37 to 42 weeks of gestation. That makes sense. The fetus should present its head, cephalic presentation, as the leading part. So head should be the leading part. Without undue prolongation, there is a specific duration. So if it exceeds that, it is prolonged, right? So natural termination of with minimal aid. So as less aid as possible. So we don't want forceps or vacuum extraction. So in case if it is this, it is not normal labor. So no complications affecting mother or baby. So both should remain in good health throughout the labor process without any adverse outcomes. Coming to the opposite of this, abnormal labor, what does it mean? So it is also known as dystocia. It can include malpresentations, prolonged labor, complications. So presentation other than the vertex, which is breech, you may know, the feet being the presenting part, face being the presenting one, and the shoulder. Prolonged labor lasting more than the usual expected duration. Complications, any maternal or fetal complication that may arise during labor, which can include fetal distress, uterine rupture or obstructed labor. Stages of labor. So mainly divided into three stages, but there is one additional stage which is useful for postpartum observation. So what are the different stages of labor? So first one is cervical stage. Second one, expulsive stage. Third one is placental stage. So you looking at the names, you might have guessed what it means. So this stage, first one, begins with onset of true labor pains. So onset of true labor pains ends with full dilatation of cervix. So we need to know, why is it given true labor pains? So true labor pains versus false labor pains. Yes. So let's see what it means. What's the difference? So false labor pains refers to Braxton-Hicks contractions. So these are irregular, unpredictable and weak, whereas in this particular case they are regular, rhythmic and progressively stronger, and they increase over time. These remain stable or decrease. Duration is short, does not increase, and felt mainly in the lower abdomen, but in this case lower back and radius to the abdomen. And here in this particular case it doesn't stop with anything, this stops with certain kind of intervention by the mother. Cervical changes, here there is, this is a part of labor, this is not a part of labor, so no effect on cervix. Here there is bloody show, which is we will learn, which as we learn it is a part of the labor, one of the stages of labor, and here there is no bloody show. And water breaking, it happens in case of true labor but doesn't happen in case of false labor. So these are the difference between true and false labor pain. So that is what is mentioned here. So it starts with the true labor pain, so that one is a part of cervical stage, ends with full dilatation of the cervix. So cervix should dilate, right? So you want the baby to come out of the cervix. If the cervix is not dilated, what will happen? The baby will stay inside. Cervical effacement and dilation. So here you can see how it looks like, the cervix being effaced and dilated in these three images, and in this particular case effaced. So yeah, so what's the duration? So primary gravida it is 12 hours, like really long, almost half a day, and multigravida is half of 12 hours, so 6 hours. So subdivision, so first stage of labor, which is cervical stage, subdivided into two, latent and active. So latent one is slow cervical dilatation, 0 to 4 centimeters. Contractions are irregular and mild. So this one makes sense. Do not confuse this with Braxton-Hicks contractions. This one is different. So active phase, rapid cervical dilatation from 4 to 10 centimeters. So it maximum is 10. So this is 10 in the active phase. Contraction becomes stronger, more regular and frequent. So that is active phase of first stage of labor. Key terms: effacement, which is thinning and shortening of cervix. Here you can see how it looks like, thinning and shortening of cervix. So you can see how the cervix is getting shortened and thinned. Dilatation, opening of cervix. Here you can see how the cervix is being opened slowly. Formation of bloody show or blood tinged mucus discharge indicating cervical changes. Let's see if it is getting recorded. Yes. Yeah. Bag of waters, bulging amniotic sac in the cervical canal. So here you can see in this particular image there is bulging sac of amniotic, bulging of amniotic sac in the cervical canal. So with this we come to the end of the first stage of labor, which is dilatation of cervix and effacement of cervix. We have learnt about the duration of subdivisions and the key terms, key features of this particular stage. Coming to the second stage, which is the expulsive stage. So looking at the, coming back, like before delving into this, we need to make sure that we know that this is stages of labor are different from mechanism of labor. Mechanism of labor, it referred to the movement of fetal head, but in case of stages of labor we are referring to the changes in the genital organs of the female, so that products of conception are expelled out. In that particular case, one of the product of conception, fetus, was being expelled, and the process through which it happened, it required movement of fetal head and all of these body parts. So that was mechanism of labor. In this particular case, these are the stages of labor. So both are completely different things. Let's not mix them up. Coming to the second stage, which you might recall, it's the fetus being delivered and all that. So it might be somewhat related to that particular mechanism of labor. So it begins from full dilatation of the cervix and ends with expulsion of fetus from the birth canal. It is also known as the pushing stage. So duration, in primary gravids it is 2 hours, and multigravida it is half an hour. So 1/4 of this. Subdivision. So even here we have passive stage and active phase. Active phase and passive phase. So in passive phase, the head descends due to uterine contractions without maternal pushing. So maternal pushing not involved. Active phase, the mother actively bears down to assist the delivery of the baby. So this one makes sense. Key features. So even here we have some maternal effort, strong bearing down efforts, to assist in pushing the baby through the birth canal. This one makes sense. Crowning, the fetal head becomes visible at the vulva. Let's see if there is a image. Yeah, so here you can see how crowning looks like. Even here, and the baby's head is visible to the vulva. In here you can see it. So we are clear with what crowning is. Delivery of the fetus. The fetal head is delivered first, followed by the shoulders and the rest of the body. So this correlates to some of the phases of mechanism. Third stage. So this one is placental stage. Begins with the expulsion of fetus. So fetus is out. Now what do we have to deliver? The placenta, placenta and the membranes. So what is the duration like? Spontaneous labor 15 minutes. So without any kind of intervention or anything, and active management is reduction to 5 minutes. So hope you remember AMTSL, active management of third stage of labor. So that is related to this particular aspect, third stage of labor, wherein the placenta is being separated and expulsed and being thrown out, not thrown out, where the expulsion of placenta occurs. So here there is mechanism. We need to know the mechanism of placental separation. So we have some methods. So first one is the Schulz method, and the second one is Matthew Duncan method. So let's see. There is a image. So here you can see how it looks like. So the Schulz method. So over here you can see the cervix is being separated. So this is the cervix. This is the uterus. So this is the umbilical cord, and the baby was attached here. So the thing that is facing the baby, that is being separated first. So the central part is being separated first. So that is Schulz method. And in case of Matthew Duncan method, the peripheral part which was facing the maternal side, the cervix and all that, the uterus and all that is coming out first, not the fetal side, not the central part, the marginal aspect. So that is the Matthew Duncan method. So we know what these two mean. The Schulz method, placenta separates centrally and expelled with the fetal side presenting first. In Matthew Duncan, the placenta separates from the margin and is expelled with the maternal side presenting first, coming out first. Key features, signs of placental separation. This could be asked as a 3 marker. So better to know what this thing means. What are the different signs? Lengthening of umbilical cord. So we know umbilical cord is increasing. You can see the size. Because it is placenta is being separated, gush of blood because it is getting separated, and rise of uterine fundus because it is getting separated. Expulsion assisted by control contraction. So we have learnt about this in active management of third stage, where control contraction is done using Brandt-Andrews method. So let's look at Brandt-Andrews method once again, so that the idea is clear again. So here you can see the one with one of the one of the hand, the physician holds the lower aspect of the lower abdomen, the above subpubic symphysis, and with the other hand there is gentle traction of the cord, and it is ensured that uterine inversion is not taking place, and it is very important to do it in a skillful manner. So that was the third stage of labor. And then finally the fourth stage, which is an additional stage for postpartum observation. So that is first hour after the delivery of the placenta, focusing on maternal monitoring. So we monitor the mother. So key features: monitoring the postpartum, monitoring for PPH. So vital signs, uterine tone and vaginal bleeding are closely observed. Uterine retraction, ensuring uterus is firm and contracted. So uterine retraction, let's look at it over here. Uterine retraction. So yeah, over here. Yeah, what's the difference between contraction and retraction? With each uterine cavity becomes a little smaller. Retraction is property of other muscles, most marked in the uterus. And no, this is not the one. Yeah, here the state of muscle fibers remaining shortened after the contraction during labor. So they remain contracted. So that is what it means. They remain contracted. The state where uterine muscle fibers remain shortened after contracting during labor. So how does this help in? It helps in making sure that the uterus size is reduced. So that is one thing. Another thing is the blood vessels which are there in the uterus, those should be in a constricted state. because if they were in the diluted state, the more of PPH would have occurred. So that is another function of uterine retraction. And finally, uterine initial bonding, mother and baby bonding, skin to skin contact, and initiation of breastfeeding. So having noted that it happens during first hour of after delivery, so initial bonding is a key aspect as well. Coming to finally the physiology of normal labor, which is an added topic in this particular question. So during pregnancy there is slightly significant hypertrophy, hyperplasia of uterine muscles. So these affect various parts of the stages of labor. So by term, uterus measures about this much, 35 centimeters in length, including the cervix, and fundus becomes wider transversely, and AP diameter, AP anterior posterior diameter, transverse, AP and lengthwise, and which is more than the lower uterine segment. So upper part, the fundus, becomes wider transversely in AP than the lower part. So that is something you need to keep in mind. Factors contributing to the onset of labor. So there is uterine distension, hormonal changes, and fetoplacental signals. So first one, stretching of the uterus by growing fetus triggers contraction. So if you can remember how the oxytocin works, the physiology of how oxytocin works during the onset of labor, the first initial trigger is the stretching of the uterus by growing fundus, growing fetus, and hormonal changes, increase in the levels of estrogen, prostaglandins promote uterine contractions. Finally, fetoplacental signals, the fetal hypothalamic pituitary adrenal axis activates, increasing cortisol and CRH, which stimulate labor. So these are the fetoplacental signals. And with this we end the discussion on physiology of labor and overall stages of labor and the difference between normal and abnormal labor. So with this we end the video. In case you like this particular presentation or way of learning, you can like this video. In case you would like to watch more of such videos, you can consider subscribing. And in case you have any suggestions or any kind of mistakes that you found in the video, you can comment or you can comment or discuss whatever you want in the comment section. Up to you. Okay then, bye bye.